So AW, her son, was in treatment for 6.5 years, correct? So I think of the people here on the panel, he had one of the longer treatment trajectories. I think we covered that in your pamphlet, but I think the range is probably 3 years. How many people's children were done in less than 3 years? Raise your hand. Okay, so when your school district says you need to be done in 6 months, that's your statistic from this panel. How many people's children were done in fewer than 4 years? Okay, so 3 to 4. Anybody at 5 years? Okay, and you heard that Leslie's son was 6.5. Nick was in treatment for so many years that I really can only tell you that when he was a teenager, he was still getting home therapy. And without talking too much about his experience, he was older than most of these children. Most of these children started at 2.5 or 3 years of age. Was anybody's son older than that? Joe, maybe your son was?
No, he was 2.5.
Okay. So there may really be a huge, I think we're seeing there's a huge benefit at starting at 2.5 or 3 rather than, in 1994, 4.5 was considered early diagnosis. So Nick's therapy went on for about 10 years. And finally, when he was a teenager, he came to us and he said, I can't do this anymore. I need to be able to, be on my own. But the point that I'm wanting to make is just that there's not exactly a recipe for this, except for that it's going to be really long and really hard and really intensive. So that was just what I wanted to say about that.
Can I add one more thing, Bonnie?
Of course.
You know what I have found, and speaking to a few of my friends now, what we found after finally making it out is that it is not something that happens quickly. And we're used to really moving fast-paced. It is a marathon, and you just have to stick with it. And I remember 3.5 years into it, I was still having to prompt, I want a drink. And I remember thinking, oh my God, am I going to be doing this for the rest of my life? You keep going, you won't believe it. It's unbelievable. Sitting where I am now, I can't believe it. And I am so thankful. I can't say enough about ABA.
What can't you believe?
Well, I think that there was, when I came into it, what happened, I read a book, Let Me Hear Your Voice. I didn't hear from anybody about what I should really be doing. Regional center directed to ABA 10 to 14 hours, I think 12 to 14 hours they maybe gave us. I met, a week, and that went on for about a year. About halfway through it, because I was reading things, I didn't need any other parents. Really, I hired somebody who had training and working with a 6 to 40 hour program, and she came in, and whereas previously the company would teach him one word receptively, expressively, and doing it in about 2 weeks, she went through like 12 words in 1 week, and he knew them expressively, receptively, and he could do it. And that was worth 369 hours, her coming in 3 days a week, 3 hours. And she told me, that it's these young college women who are, anyway, she told me that, to really give him a chance to get him a program, 36 to 40 hours, and, spend some time on that and see if he could make it. At least I knew I was giving him a chance that he could do it. And I am so thankful for these young people's wise words, because I didn't hear it from a doctor. I didn't hear it from a neurologist. I don't know that there was, the hope was that book, Let Me Hear Your Voice. I told my husband, this woman had a plan, it worked for her, maybe it'll work for us. And
so how long was AW in the less intensive treatment before he started his 40-hour program?
For one year. He was in the less intensive program for 1 year. And then we were on a wait list for about, I think it was 9 months. And then we started with CARD. And
so there may be some correlation between the year where you did less intensive intervention and your treatment trajectory as opposed to those people in the panel who started with the 35 or 40 hours.